Bandy and, Dr. Quentin there. And then we have an interaction, yes, and Q&A for those who are online as well as those in the room. So without further ado, let me ask Quentin to give us the opening remark.
Thank you very much, Remy. So as mentioned, this is the global launch of Planning for Healthy and Happy Learners. That is an initiative among many different partners, UNESCO, GPE, UNICEF, World Food Programme, WHO, and a few more. My name is Quentin Wadden. I'm the director of UNESCO IGBA. We believe very strongly in the importance of investing in healthy and happy learners. I'm not going to talk about the projects that we have, but we have a few, as well as quite a bit of analytical work. The one thing I did want to mention before giving the mic back to Remy is that for those who are new online to our webinar series, this is a webinar series that we do every month with 3 other key partners. The Global Partnership for Education, together with Canada's IDRC, the African Union, AFTRA, which is the Africa Federation of Teaching Regulatory Authorities, and then, of course, IGBA, the International Institute for Capacity Building in Africa, that I represent. We do those webinars 2 hours, normally at 3 p.m. On a Thursday, once a month. And we will send you, of course, the video and the presentations for this webinar. And if you would like to participate in others, you just let us know. The next one will be on December 10 on inclusive education, and especially how to make sure that children with disabilities can go to school and learn in school. Let me stop here and give back the floor to Remy, and thank you to all the panelists and all the participants, including in the room.
Thank you. A round of applause, please. So Quentin was asking me if, I've already prepared some jokes or I make them on the spot. And I did tell him, some of you think I'm doing a good job. You should see me when I'm being paid for this. If you pay me, you have a good time. So we'll keep it simple for now because I'm doing it for free. But right now, let's go into the presentations. I will start with you, Prof. Don, and then we'll move to Xavier. You can use the podium so you can see the screen. Let's give him a round of applause.
I think we might be all working here for free, Remy. So I'm delighted to be part of this. I don't know if those who are watching on Zoom realize there are 24 countries in the room. So it's been an extremely rich 2 days so far discussing these issues. And one of the issues, there are many of us here who are parents, and certainly many people online who are parents. One of the issues we always raise when we start talking about research and evidence when we're talking about the well-being of children. I don't think there's anybody that doubts that health and well-being are important for education. They're essential. The question is, where do you put your investments in terms of getting better education outcomes? And what I'm hoping we'll be able to discuss, to explain, is the value of investing in the well-being and health of children as part of the investment in education. So that's the question that we're starting with is, why is health and well-being of importance for education? And the first slide that I'm presenting here is, we are at a stage where 84% of the world's children are in school. This is the most children that have ever been educated through education systems. But the biggest number, but also the biggest proportion. And part of this drive was something that happened in the Millennium Development Goals. So we have a huge number of children are in school, but are they learning in school? And some of the statistics on this slide say no. Say that the learning is falling behind the participation, and we need to ask the question, what is it that would make the difference there? Well, a key issue is illustrated on this slide, which is looking at the life course of any one of us. So this is the life course as we develop. And if we think of the population we're dealing with, there's the first 1,000 days of life, which is a huge area of focus in terms of health and well-being investments, and needs to be. It's really crucial for the rest of life. And if we look at the way that health investments are spent, there's a big focus there. And then the health investments again go up in middle life. But for school children and adolescents, they are the most neglected age groups by the health systems. And this is now become a well-identified, well-characterized issue. And what we now talk about is we talk about the first 1,000 days of life, investing in that, but then we have to ask the question about the next 7,000 days that takes that infant through into adulthood to become part of the next generation in our societies. Are they learning? Is their health good? And we're seeing an increasing number of publications showing that both in terms of nutrition and in health generally, we have underestimated the amount of ill health that those young people experience. And of course, we see that there's some very vulnerable periods in development during that phase. This includes, for example, puberty. These are issues that we have not been addressing, but we are now as communities addressing now. UNESCO in November 2024 at Fortaleza in Brazil devoted part of its global education GEM meeting to the issue of well-being and health and how that influences education, and raised these three important points, these three actions. The need to deepen the connections between the health communities and the education communities, to strengthen the sense of responsibility so that we think of health, well-being, and education as just part of the necessary investments in development of children, and finally, to increase the investments in those areas by the various sectors. So the UNESCO championed that, and really we're taking forward that message now. So what really matters? Here's a short summary of multiple health-related causes that are important to education outcomes: micronutrients, vision, malaria, deworming, bullying, menstrual health, hand washing, all very different aspects related to health and well-being, but all important and all demonstrably affecting education outcomes. And when we look at the next slide, please, this is an idea that actually dates back to the whole Education for All message in Dakar in 2000. That's 25 years ago. And the issue then was other priorities, especially attendance and teaching, were held to be much more salient. Indeed, in those days, people thought that investing in the health and the well-being of children was, if you like, a tax on education. But what we now realize is that it's actually a synergistic investment. It's part of the same investment in the growth of our children. And when we look at the different sorts of interventions, this is just a slide that attempts to summarize the range of interventions that are important. And we can see that they're of different importance and at different ages, so in different points in the education cycle. But these are all interventions that have impacts that are effective when delivered through schools. So this is part of the school-based range of interventions that are relevant. And what we also see is that these kinds of interventions work at scale. And I'm going to give you the example here. This is the example of the school meals movement. That's been a very powerful movement since all the schools in the world closed during COVID. And many of those school meals strategies also deliver complementary health interventions at the same time. But the message here is that worldwide, this is World Food Programme data, worldwide, 466 million children are fed every day in school. That's more than half of the world's children are receiving this really quite complex commodity, and that it's being paid for 99% by domestic funds. In other words, these are now public programs, public policy programs that governments are committing the funding to cover. So that's one example. But I also wanted to just then move on to a few to this slide, which attempts to really just highlight a number of examples of where of interventions into health and nutrition and well-being have demonstrable benefits. And what we're showing here, or attempting to show here, is some data, for example, for Malawi. The maps are from Malawi. And what they show is that in those areas where school meals programs have been effective, or for school health programs have been effective, they have increased the numbers of years of education experienced by the children. This is for the same education investment. What we're making, the difference we're making, is to the learner's ability to take advantage of the existing education investment. That's what makes this an investment. And what we also have here is data from the Oxford What Works lab, showing that these investments also improve learning. They improve numeracy and literacy as outcomes. So it's not just about time in class, it's also about the quality. And finally, what this shows is also looking at LAYS, the learning adjusted years of schooling, so a measure of how much you're investing and what's the improvement you get from that investment. What we see here in the histogram is that we've got results here for general health interventions and also separately for school meals, is that the levels of benefits are very similar to those you see with many of the education investments. That they are showing similarly cost-effective returns. What that tells us is we need to do both of those things to achieve our goals. And a lot of these ideas are summarized, if I have the next slide, please, in a recent publication by the UNESCO GEM team. And what's the main message here? This is about education and nutrition, fairly specifically. And the message here is eat well to learn. That's the message I've been saying already. If you eat well, you'll learn well. But the other message, and this is very important, is learn to eat well. Meaning that when children are in school at a school age, that's the time to help them understand what's the right food to eat, to avoid their exposure to some of the predatory practices of some of the food suppliers, to help them throughout their lives, because what we learn at that age affects our behavior lifelong, to ensure that they have behaviors that help them to eat well because they've learnt what to eat. So there's lifelong benefits, and we could add up here the fact that those benefits are also for planetary health, and one of because children can choose to eat the right things in terms of sustainability on the planet. And we're now looking very carefully at the importance of what children eat at that age for their risks of disease in middle age, the risks of diabetes, obesity, and cardiometabolic illness. And why does all of this matter? Well, obviously it matters from all kinds of moral and technical standpoints, and indeed scientific standpoints and sociological standpoints. but it also matters from an economic standpoint. And this is these are data from the World Bank looking at the issue of human capital. Human capital is the skills, the education, the good health, the longevity of the population. When we feed children in schools, when we make sure they have good health in schools, we're hoping that will carry on throughout their lives and will support them lifelong. And what this is looking at is how does that relate to the relationship with the economics of their country? And so we've got on the x-axis of this graph an index of human capital, and on the y-axis the wealth of those nations. Each circle, each dot is a country. And what we can see is that at the right-hand side of the graph, the higher income countries, something like 70 to 80% of the wealth of those nations is coming from the work of their people. Whereas at the other side, on the left-hand side, that figure's much more like 30 or 40%. People make much less of a contribution. And this is itself a double tragedy, because what it's saying is that the poorer nations have less prospect of their communities contributing to their development. But it also means that those individuals in those nations are not realizing their full developmental potential. So there are many rights-based and moral reasons why this is also an unacceptable position. So to wrap that up from the economic side, this is an illustration of the nature of the economic returns from an investment in good health and good nutrition. And what it shows that one nutrition program, one health program, has benefits that are measurable across many sectors. So yes, we see great benefits to the education sector, but also to the health sector, to the social protection sector, and to agriculture and other sectors, especially gender. And that those returns add up and make this a particularly strong investment. These, you've heard the figure, for example, some people have suggested $1 invested, you get a return of $7. There are various estimates of that. But what that shows is that this isn't simply a cost, it is an investment in the nation. And so to conclude on that, in the next slide, we can see that there are four conclusions that we're offering here. One is that health drives learning, and that health and good and well-being at school is crucial to education outcomes. Secondly, that these returns are multiple across many sectors. So the returns are much bigger than you imagine they are. These are not just returns, or not only returns to education. And thirdly, that to make this work, we need much more collaboration across sectors, much more engagement of sectors beyond education in the education of our children. And that's why the fourth point is the suggestion that sometimes we should be talking about a ministry of for future generations rather than the sector ministries, because that's exactly what we're talking about. We're talking about investing in a child so that that child grows up to be a productive adult who contributes to that nation's wealth. And to finish, I just want to so a bit of an advert for the Research Consortium. We have a worldwide academy of 1,300 professors and practitioners. Those of you listening who find this interesting and want to engage, that's how you can join us. Thank you very much.
Thank you very much, Prof, for giving us, insights on what the data says. Now, we'll go to Xavier. I don't think there's a mic there, Xavier, so you want to use this one.
Thank you, Remy. We have heard the evidence provided by Professor Bundy. And in fact, already in 2022, at the Transforming Education Summit, next slide, please. at the Transforming Education Summit, already 60% of national statements highlighted the need to address students' and teachers' health, well-being, and safety. And this is acknowledging those statements, the evidence behind them, the country experiences, the experiences of learners, that a unique group of partners joining UNESCO, UNICEF, the World Food Programme, Global Partnership for Education, the World Health Organization, the Research Consortium on School Health and Nutrition, the UNESCO Chair Global Health and Education, and the World Bank joined forces to support countries converting those statements into realities for teachers, learners, and education systems. And this is why they have decided to invest in integrating health and well-being in education sector planning in a program of work which is called Planning for Healthy and Thriving Learners. What is this program of work made of? It is made of a series of resources and activities that together will allow us to convert the statements into effective integration of health and well-being into education sectors, into education systems. They start with two tools that we are launching today, a brief and a handbook. And I believe that the QR codes have been provided in the chat of the Zoom or will be provided for you to have direct access to those resources. The briefing makes the case for investing in health and well-being in education sector planning. It resumes the evidence that has been presented to you. It shows that investing in health and learners is actually investing in their education. More years of schooling, less absenteeism, more learning. It shows also that it is cost effective. So it provides a very strong arguments to convince stakeholders, ministers, that this is indeed a good investment to make. The handbook I will be talking about in the next slides. But this is not, the program of work is not limited to 2 publications. It also means technical support to countries at country level. It also means the creation of a pool of experts that can join planning processes when they happen to make sure that health and well-being are not left behind. It also means a training program delivered by the International Institute of Education Planning, and that I will be describing in the next slides. And finally, it means mapping of country planning cycles so that we can be prepared to support countries when they need it. So speaking about the book, what is it about? Integrating health and well-being into education sector planning. At what level will we be working? We will be working to protect and promote the physical and mental health and well-being, as well as the development of social-emotional skills of learners in policies and laws, in education for health and well-being, in school physical and social-emotional environments so that they're healthy, safe and inclusive and conducive to learning, and in school health and nutrition services. We are not asking the education sector to do all this work alone, but to join forces with other sectors to achieve it, ensuring that the education sector takes the role of the leader in the process to make sure that education sector planning drives the movement. Driving how? Well, going through the different stages of the planning cycle, and this is how the handbook is organized. It shows, for instance, in chapter 2, how to analyze the status of health and well-being of learners and teachers, to integrate that into the education sector analysis. In chapter 3, how to analyze policy and provision with regard to health and well-being programs. In chapter 4, to formulate priorities and strategies. 5, to design programs and the implementation. 6, to understand how to calculate the cost and finance the activities. And 7, to monitor, evaluate, and learn from the planning cycle. For instance, when we think about analyzing the status of health and well-being, and we ask ourselves, what are the major health and well-being issues in the country? What is the effect on education? What are the available indicators and data sources? How should we disaggregate by different groups of learners? The handbook provides a series of resources that we can draw on. Those resources, data sources, are represented here by a series of acronyms that I don't expect anyone to understand, but fortunately, we have the handbook to be able to read them and use them. And it's the same thing for analyzing policy and provision. If we want to understand what is the policy environment with respect to health and well-being, what are the programs, school health and nutrition programs that are being delivered through the education system? What are the resources and implementation capacity? Again, we have many tools that are made available through the handbook in order to conduct that analysis. And that leads to formulating priorities and key strategies to identify the school health and nutrition priorities, to understand what tools and data can assess school health and nutrition among national education priorities, and to mobilize stakeholders and advocate for the programs. Again, the handbook provides the resources. Next slide, please. Besides the handbook, we have a training program that will be delivered in 2026 and beyond by the International Institute of Education Planning, which will be delivered to the directors of planning, to directors of staff of education management and information systems, by school health departments within ministries of education, to external partners, to other ministries, such as Ministry of Health or Social Affairs, because again, health and well-being in education is not only the affair of education planners, even they will be the one leading the process. The course will be delivered online for 100 hours over 9 weeks, and will lead to a certification by IAEP UNESCO, giving credits that contribute to a specialized diploma of education sector planning and management. So giving official recognition of the participation achievement of the course. The objectives, next slide, please. The objective of the course, before that, please. Yes, thank you. The objective of the course is to explain the importance of integrating health and well-being into education sector planning, as has been described by Professor Bundy, to conduct the education sector analysis, to formulate priorities, to identify the resources that are needed to implement the plan, and how to collaborate with key stakeholders to ensure health and well-being is successfully integrated into the plans. Next slide, please. So here we are. The tools have been finalized, the handbook and the briefing note. We are today proud to launch them along with, as part of the initiative, the program of work planning for healthy and thriving learners, the training program is being developed and will be launched next year. And we will keep working during the following years to ensure that this does not stop here. And to ensure that countries can effectively count with the assistance of the members of the Interagency Group on School Health and Nutrition. Thank you very much.
Thank you. Thank you very much, Xavier. And if you do have any questions for any of the speakers, maybe you have questions, for Prof. Don, please just jot them down and then we'll take some questions later. For now, we are connected online with the Minister of State for Education in the Republic of Maldives, Dr. Mohammed. And we want to look at some country level experiences about this integration that we're talking about. Minister, can you hear us?
Yeah, thank you so much. It's a pleasure me joining you online. And can you hear my voice?
Thank you very much, Minister. We know that the Maldives was part of the pilot of this work at the beginning of the year. Could you just share with us some of the lessons that came out from that pilot, but also what prompted your country to take interest in this work and to take this work forward?
Thank you so much. Once again, it's a pleasure to address you as a panelist in this very important webinar. As you have mentioned that we took part in the pilot phase of piloting this handbook and integration of health and well-being in our education planning. Actually, we were very prompted to take part in this important journey is because the Maldives has long implemented a school health program, which is integral to the school quality assurance and even accountability framework. The COVID-19 pandemic underscores the importance of mental health and prompting us to address emerging concerns even after this period. And it also highlighted that the interconnectedness of health and well-being and learning. This is one of the crucial areas, as we know that there is a correlation between health and well-being and student learning. So when they are healthy, they learn better, and also even the education provides much more information about the health and well-being of the children. So after resuming the normal school operation post-COVID-19 disruptions, we strengthen our mental health program with support from different international agencies, helping adolescents to thrive initiative. And we realized that our school health and nutrition program, including the school wash program and also socio-emotional learning and also well-being programs, were being implemented in isolation, and which necessitated change. So this is one of the reasons why we were very prompted to take part in this. And additionally, we recognize that health and well-being were not comprehensively included in the first education sector plan from 2019 to 2023, other than free breakfast in schools, which was mentioned in that document. But it was not comprehensively mentioned and addressed in our very first education sector plan. So to ensure these aspects receive due importance, they must be integrated into the sector plan. And in 2024, the Maldives embarked on education transformation agenda focusing on equity and inclusion, in part supported by the catalytic funding from Global Partnership for Education and also our development partners such as UNESCO, WHO, UNICEF, and the World Bank. So creating an inclusive, but in the meantime, safe learning environment that uphold the well-being of students and teachers became a key component of our agenda. So we acknowledge that health promote in schools are essential not only for learning recovery, but also for improving learning outcomes for every child. So to simply, if we put, if students are not healthy and safe, they cannot learn, as I mentioned before, and thrive and be resilient. We need to take part in this very important journey. And also, at the meantime, the health and well-being of both students and teachers is one of our key policy priorities of the National Education Strategy for the time period of 2024 to 2028. And this is another reason why we committed in this, and we committed to strengthen the capacity for education sector planning. So the pilot was timely because it was the time we embark on developing our next sector plan. And it was the time we try to come up with a new strategic action plan for the education sector. So it was very timely as we required the technical capacity to integrate health and well-being into our sector planning, and we eagerly accepted this opportunity. And if you look at the lessons that we learned from this experience, one of the very key lesson we learned, or the insight that we received from our experience, is that we recognize that we have numerous policies, many of which overlap with those developed by relevant stakeholders such as Ministry of Health and Ministry of Sports. And it is crucial to streamline these policies to prevent schools from being overwhelmed by competing priorities and with limited resources in the country. So we also identified the need to review extracurricular activities and in schools, prioritizing health and well-being activities that are relevant and also engaging for the students. And we also believe that we also recognize that our educational planners at the Ministry of Education and even others need widen their focus to realize more transformative vision of education by integrating health and well-being. And also we appreciated the diverse stakeholders willing to collaborate with the Ministry of Education and the development partners, because by leveraging the comparative advantages of these stakeholders, we can implement effective health and well-being services in schools rather than the Ministry of Education being the sole provider. So we need to find ways to stakeholders to work meaningfully with schools, ensuring student learning through classroom activities, even the club-based activities, and especially to promote inclusion as well. And at a very before I conclude, I would also like to mention that can you hear my voice?
Yes, I think we had lost you a little bit. You were saying as you conclude.
Oh, all right. Okay, so before I conclude, I would like to highlight that the things that we learn from this piloting exercise is that it is something really important, and sometimes our educational planners, they don't look into a holistic way of looking into health and well-being. Sometimes it is kept in isolation, and this is the reason why we also need the stakeholder collaboration when we try to develop the educational plans for the entire system, and even for the country perspective. Thank you.
Thank you very much, Minister, for sharing some of the reflections from the pilot in the Maldives, and really just emphasizing the importance of multi-sectoral collaboration and the interconnectedness of this work. Another part of this work is monitoring, it's data, it's ensuring that we integrate right indicators that can measure issues around education, health and well-being. Turning to Zambia and the experience from Zambia, we know that you've made significant progress in integrating health and well-being indicators into EMIS. What were the key enablers that made this possible, and what challenges did you experience?
Thank you very much. Indeed, Zambia has progressed in integrating health and well-being of the learners in the education information management system. And some of the enablers are the strong national leadership and commitment to the evidence-based planning. You may know that our president of the Republic of Zambia is a champion for education in Africa. And this demonstrates that we have a strong leadership in Zambia and support to education. And the country has prioritized education as one of the strategic focus. And we have also prioritized data-driven decision-making as one of the key strategies that will strengthen learner outcomes for proper decision-making. We have also seen effective multi-sectoral coordination in Zambia and support from key stakeholders. And some of the stakeholders that have come on board to support data collection and enhancement of inclusion of health and well-being for our learners indicators on the EMIS, UNESCO. We also have the UNFPA that have come on board to try and support the ministry to ensure that we have collected evidence-based data that has supported us in making the correct decisions.
Thank you. Thank you very much. And that's Ms. Linda Swale, the Director of Planning and Information for the Ministry of Education in Zambia. Let's turn to Cameroon and just hear also your lessons as well as experiences in integrating indicators into EMIS on health and well-being.
Je vous remercie, le Cameroun vous remercie de l'avoir associé à cet événement très important pour la santé de nos élèves. Cela fait longtemps déjà que le Cameroun accorde une très grande importance sur la santé et le bien-être des apprenants. D'autant plus que cela aide à la prise de décision basée sur les données probantes. Donc, c'est ainsi que nous avons intégré quelques indicateurs, plusieurs indicateurs même, dans notre système d'information pour la gestion de l'éducation. Donc, nous avons, par exemple, intégré les données sur les handicaps moteurs, visuels, auditifs, sur les enfants autistes, sur les infrastructures, par exemple les latrines genrées, les aires de jeu, les enfants, en fait, le matériel pédagogique destiné à l'apprentissage inclusif. Voilà. Et depuis un certain temps, depuis 2021, nous avons été amenés nous avons été admis au programme de renforcement des capacités sur la santé et le bien-être de l'IPE Paris, tel que vous l'a présenté hier Madame Stéphanie Lett. Donc, depuis 2021, nous travaillons sur 4 indicateurs de base qu'elle a appelés GC2, GC3, GC4 et GC5. Donc, depuis 2021, nous collectons les données sur ces indicateurs-là. Et il faut dire que cela n'est pas allé sans difficulté, hein. On a commencé par essayer de comprendre chaque indicateur pour l'intégrer dans nos outils de collecte. Parce il faut intégrer les questions qui nous permettent de collecter les données dans nos outils de collecte. Donc, il faut expliquer chaque terme à nos agents de collecte. Et donc, en ce moment-là, nous avons intégré dans nos questionnaires. Et depuis 2022, nous avons terminé l'intégration. On a commencé à collecter les données. Généralement, la collecte de données se fait lors du recensement scolaire annuel, généralement, dans les écoles. Et donc, il a fallu former d'abord le personnel de l'administration centrale, donc le personnel de la cellule de la planification. Ensuite, nous avons formé les chefs services régionaux de la carte scolaire sur les items, sur la compréhension de quelques items, afin que nous soyons sûrs que les agents de collecte comprennent ce qu'ils font. Et cette formation-là, n'est-ce pas, est suivie sur le terrain par ces chefs services de la carte scolaire jusqu'au directeur d'école. Ce sont les directeurs d'école qui sont les agents de collecte. Donc, on envoie les questionnaires, le directeur d'école leur renseigne et puis il nous les renvoie par voie hiérarchique. Par exemple, chez nous, à l'éducation de base, vous avez l'école, le directeur d'école, l'inspection, le département, la région et le niveau central. Que ce soit au ministère de l'Éducation de base, puisque nous en avons deux, le ministère de l'Éducation de base et le MINESEC. C'est les deux ministères qui ont été admis dans ce programme-là. C'est vrai que depuis l'année passée, il y a d'autres ministères qui veulent intégrer ce programme. Donc, et à partir de là, nous produisons les documents que nous demande l'équipe du programme. C'est-à-dire, au départ, c'était le rapport d'analyse. Alors, puisque c'était un gros document, on a commencé à nous demander la note technique, qui est pratiquement une synthèse du rapport d'analyse. Mais avant ça, il faut produire les tableaux fictifs. Il faut produire les tableaux en statistique après avoir collecté les données, après avoir apuré ces données-là, n'est-ce pas? On produit les tableaux fictifs. Donc, après avoir produit les tableaux fictifs, on sort la note technique. La note technique et en dernier lieu, le document de recommandation. On envoie tous ces documents-là à l'équipe du programme à Paris. Et nous attendons leur retour. Et il faut dire que ce programme-là, on assiste à un webinaire une fois par mois, donc tous les mois. Généralement, c'est du mois de mai au mois de décembre. Cette année, la clôture, ça sera au mois de décembre, le 10 décembre. Donc, c'est ainsi que nous travaillons dans ce programme-là. Et nous avons produit, depuis 2023, quelques résultats. Et en 2024, on a constaté que tous les indicateurs ont baissé, ont connu une baisse. Et cette année-ci, on a encore constaté qu'il y a eu un relèvement de quelques indicateurs, GC2, GC3 et 5, par exemple. Donc, C'est comme ça que nous procédons. Et ces documents-là sont aussi produits dans nos documents internes. Nos documents internes, c'est-à-dire l'annuaire statistique et le rapport d'analyse de chaque ministère. Chaque ministère procède aussi à l'analyse des données dans son secteur. Et ces documents-là se trouvent dans nos sites Internet. Pour le Minedup, c'est le www.minedup.cm. Pour le Minesec, c'est minesec.cm. Et depuis un certain temps aussi, nous avons le secteur de l'éducation et de la formation. Et ces documents, on peut les trouver dans le siège de l'INS, dans le site de l'INS chez nous.
Merci.
Je vous remercie pour votre aimable attention.
Thank you. Thank you very much. That's Mr. Awono, the Assistant Planning Officer in the Ministry of Basic Education in Cameroon, sharing the experiences from Cameroon. I would like to move now to UNESCO ICBA. And Quentin, if you could just talk a little bit about the program on, for example, eye health. How is it less costly? What makes it highly impactful?
Thank you, Remy, and I'll start my timer so that I don't exaggerate. First, I forgot to mention the European Union Regional Teacher Initiative for Africa as one of the co-sponsors for this webinar series. Now, before talking about school eye health, I want to get back to something Don said, and I want to make a clarification about the importance of investing in people. So I think, I couldn't see well, but I think that what Don showed was the human capital index measure for different countries. For that measure, you combine data on education and on health to see whether a child today is likely to fulfill his potential in terms of earnings in adulthood. So if the child fulfills his potential because the child gets good education, good health, the child will reach 100% of the earnings potential in adulthood, right? And I think what he showed was that in high-income countries, that measure is roughly 80%. In low-income countries, including in Africa, that measure is roughly 40%, right? So a child today in Africa reaches only 40% of his or her potential in adulthood because of lack of education, because of risk of poor health, and so on, right? Then there is another concept, which is the human capital wealth. That's the assets that a country has for future development, right? And there, what is interesting is that when you look across all of the countries, there's not a lot of difference between the share of people as a source of wealth in the total wealth. The other sources of wealth would be natural capital, that would be oil, minerals, land, and then produced capital, which are investments the country makes in buildings, in factories, and so on, right? And in Africa, as in much of the rest of the world, people, right, the future value of the earnings of the workforce represent about 60-65% of human capital. So today, in Africa, right, people represent already almost 2/3 of the wealth of countries, what you have for future development. But if you think then again to what Don presented, which was the human capital index, and we are only at 40% right now of the potential earnings that people could get in adulthood, you can see that if we invest more in health and education, and including education for health and well-being, the potential impact on the wealth of countries and the future development is just huge, right? So I wanted to clarify those two concepts. And that gives me a segue into what I want to share with you about the question on what do you do? You have to do a lot of things, right? And the manual that Xavier presented and other resources are available and very comprehensive. At the same time, you also have limited budget, so you have to invest very specifically in a few things that you know are going to have a large impact, and you know that you can actually afford to do it as a ministry, right? And school eye health was one of those. So what is that, school eye health? So you need to screen children in the school to see whether they have visual impairment. A teacher can do that after 2 or 3 hours of training, right? Essentially, some of us did that when we were young. You have letters, right? And you have to read the letters. And if you can read them well, you're okay. If you don't read them well, you may have visual impairment. Now, the good news is that 90% roughly of the cases of visual impairment can be solved with eyeglasses that cost $1 or $2 a piece. And you, as African countries, but also elsewhere in the world, can often get those pairs of eyeglasses for free because there are some foundations that provide them. They have a stock of, if I remember well, 200 million pairs of eyeglasses, right? So the teacher screens the kids. Then there is a referral, and you get eyeglasses. And if eyeglasses is not enough, that's about 10% of the cases, then you need to be referred to a clinic and you need to have more care. Now, how much does it cost? The estimations we have done at ICBAT together with the Eye Alliance, which is one of the great NGOs working on that topic, is that it costs $1 per child, right? Not per child with visual impairment, per child, right? And that's the cost when you manage to also integrate the 2 or 3 hours of training you need to give to the teacher as part of a broader training. So $1 per child is affordable. Don mentioned the benefit to cost ratios of different programs. And he mentioned $7 as one of the benchmark, but there are different studies, right? Our estimates suggest that indeed, in many countries, the benefit to cost of school eye health programs, screening the kids, giving them the eyeglasses, is from 7 to 30 or so. It depends on the country. The cost doesn't change too much, but of course the earnings potential changes, right? So it has a very high benefit to cost ratio. It is very affordable to do, right? And of course, we are happy to help you as countries do that together with various partners. So this is one example of a low-cost program that you can implement nationally in an affordable way. Thank you.
You know, there's quite a lot of interest even in the room, and perhaps I hope colleagues, you can start to see how you can plug into and reach out also to Quentin on that. Honorable Minister, Dr. Mohammed, are you still connected?
Yes, I'm here.
Okay, great. Thank you. Just wanted to ask a follow-up question. After the pilot, what are some of the next steps that either you have taken or are planning to take in the Maldives?
Thank you. After the pilot, because the pilot, the time that we piloted this program was the time that we were doing our joint sector review. And also it was the time we were undergoing and conducting the education sector analysis as well. So after this, we have decided to use this handbook when we develop the next education sector plan from 2026 to 2030. So we will try to provide some more technical guidance on how to use this handbook to our educational planners working at the Ministry of Education, and hopefully the integration of health and well-being in our policy and planning, which we would be more comprehensive and holistic when we try to develop the next education policies, the sector plan, and even other educational plans. That's one thing. And also, even before we had the mental health support helpline for our students. But what we did was we extended the mental health support helpline for our teachers as well. So apart from the students, we also provide this service to our teachers because we believe that the health and well-being of both students and educators are really important. And even with the current administration, as I mentioned, the health and well-being, this aspect is one of the key priority area. So because of that, even even though our Friday, the Friday is a government holiday, usually the schools, they conduct a lot of activities even during the weekend, including Friday. And the teachers, they have to work on 7 days per week. So it seems that our teachers did not get even sometimes, or on some weeks, they don't get a single day as a free day, because sometimes when we try to accommodate double sessions in schools, then the schools have to conduct extracurricular activities on weekends. But what we did with the beginning of this integration and this pilot exercise, and also with our commitment from the Ministry of Education, which is also aligned with the pledge of the President as well, to limit the working hours, and also to provide a very conducive environment for the teachers, and also to balance the work-life, to bring a work-life balance. What we did was we asked schools not to conduct any activity on Friday. So at least give one of the days of the weekend as a free day, and it is now it is not allowed schools to call teachers to come for any activity, or even students to come for any activity on Fridays. Apart from that, we have the we have the vaccination programs, and also we try to ensure that every child who admits to the school, they complete the vaccine programs. But apart from that, now we have planned to check the growth monitoring of the children, because we believe that it is something really important when we admit the students to check their growth monitoring. So in collaboration with the Ministry of Health, now we are trying to encourage parents to complete the growth monitoring, because this is one of the area where the parents and even the schools can do much better on early identification of different growth related issues of our children. And also we have one meal program for the needed children or needed students, and that is already an existing program. But apart from our health screening program at different levels, we also initiated thalassemia screening for the secondary students, because we want to promote awareness among the secondary students as well, for their future life as well. And the another key component is now we are in the process of developing our own EMIS, educational management information management system. And when we develop our new EMIS, we are going to integrate all the different health and well-being related data in the EMIS, because sometimes now some of the data are not very much integrated into the our data management systems, and sometimes when we manage some sort of health related or well-being related data in isolation, it is not easy for us to use it in our planning process. To enhance more robust educational planning, we need more accurate, more validated, and very systematically managed health-related data. So our plan is to integrate all the different data in a very comprehensive way in our educational management, information management.
Thank you. Thank you very much, Minister. Thank you. And we also note the commitment that you're making to integrate indicators related to, health and well-being in the EMIS as you develop. I want to also just hear a little bit about some of the challenges that Zambia and Cameroon met or experienced or are still experiencing in terms of integrating indicators into EMIS, and perhaps the Maldives can also learn, and maybe some of us can go to the Maldives to go and see what's happening there. Yeah.
Thank you very much. As much as we are progressing in integrating health and well-being data into the EMIS as Zambia, we are also facing challenges like any other country. One of the challenges that we are facing is that many schools and districts still lack capacity in using the new tools that have been introduced on the EMIS to collect data. And this has impacted on the accuracy and timeliness of producing that data. And the other issue that we have faced is as much as we are having coordination issues being coordinated by our cooperating partners and our stakeholders like UNESCO, we still have a challenge of other partners using different tools. And we need to then look at the different tools that are being used and different indicators that are being used. So then that poses a challenge in having the same kind of data to use. So this is one of the challenges. The other challenge that we have is resource constraints to reach the areas, far areas where the schools are. And also this then gives us a problem in analyzing that data in good time. I want to also say, what are we doing then to ensure that we do something about the challenges that we are facing? So we are reviewing our EMIS in Zambia, and this meeting couldn't have come at the right time. We have learned how we can integrate this data into the EMIS, the health and well-being indicators for our learners. So we are reviewing the EMIS, and we have the support of the World Bank currently in the Ministry of Education. So we have looked at these indicators that are adding more value, and health and well-being of the learners indicators is one of the priorities that we want to add on the EMIS that we are reviewing. We are also reviewing our strategies, such as the back to school re-entry policy for Zambia, where our children will come back to school. And some of the issues that will activate that are issues of school feeding in school feeding that we want to add in our reviewed policy. I also want to indicate that we have committed as Zambia to ensure that the school feeding is and health issues are some of the programs that we have added to our new strategic plan. And looking at the funding to education, school feeding is one of the programs that have been given adequate, not adequate enough though, but it's one of the programs that have been prioritized to get resources so that we can ensure that we don't leave any learner behind. This adding of these indicators on the EMIS also is going to help us have informed decisions even as we're looking at the education sector in Zambia, you may realize that also we have the free education in Zambia. So we have so many people and children coming to school. And so feeding of these children and looking at their health well-being is one of the issues that we're looking at. Thank you so much.
Thank you. Thank you very much. Thank you. And then can we go to Mr. Awono, and if you could just share some of the challenges that you have experienced in integrating indicators into EMIS on health and well-being.
Ok, je vous remercie. Tout d'abord, l'un de nos plus gros défis, c'est les agents de collecte. Nos agents de collecte, ce sont les directeurs d'école. Et les écoles, généralement, c'est dans des lieux, endroits un peu reculés. Et donc, par exemple, au niveau du MINESEC, ministère des enseignements secondaires, ils ont commencé à la collecte numérique. C'est-à-dire qu'ils font une fiche Excel qu'ils envoient et on renseigne. Le point focal à l'établissement renseigne et renvoie. Et donc, si vous êtes dans un lieu où il n'y a pas d'électricité ou les gens n'ont pas d'ordinateur, là, ça fait des difficultés. On renseigne et puis on est obligé de se déplacer pour aller envoyer les données. Ou alors, quelques personnels de l'administration centrale descendent sur le terrain pour venir les chercher. Donc, et en plus, il y a la formation même des directeurs, des agents de collecte, parce qu'on a constaté que certains remplissent le questionnaire avec un peu de désinvolture, comme si on se demandait qu'est-ce qu'on y gagne. Et donc, mais avec la sensibilisation, et c'est surtout dans le privé, hein, surtout dans le privé. Dans le privé, quand on leur envoie les questionnaires pour enseigner, les questionnaires nous reviennent vides, vierges, quoi. Donc, nous continuons au niveau de la sensibilisation et cela nous permet chaque année d'évoluer. Ensuite, nous sommes, pour relever aussi ces difficultés-là, on est en train de passer à la numérisation complète. C'est-à-dire qu'on a appelé ça le SIGE déconcentré. C'est-à-dire que l'agent de collecte, à partir de son poste, qu'il renseigne le questionnaire directement et que les réponses arrivent dans notre base de données. Bon, c'est vrai que, comme je l'ai dit tout à l'heure, cela est conditionné par la disponibilité de la connexion Internet et tout l'outil informatique nécessaire. Donc, il y a aussi, ce qu'il faut apprécier aussi chez nous, c'est la collaboration, ou alors ce que vous avez appelé la coordination. C'est-à-dire lorsqu'on lance la campagne, soit, nous adressons des correspondances à toutes les structures du ministère pour nous exprimer leurs besoins en données, en information. C'est cette expression de besoin en information que nous intégrons dans nos outils de collecte. Par exemple, nous avons une direction de la santé, le sous-directeur de la santé et des APPS qui est avec nous là. Généralement, on nous envoie des questionnaires et autres là que nous intégrons dans notre outil et nous collectons les données. Et au moment de la production et de la validation, ils sont invités. Et à la fin, on leur envoie les documents que nous avons produits pour qu'ils voient le travail qui a été fait. Donc voilà un peu comment nous travaillons. Mais le véritable problème chez nous, c'est la formation des agents de collecte. Surtout, s'il vous plaît, surtout au niveau du programme dont je parlais avec l'IP de Paris. La formation des agents de collecte, on a réussi à former jusqu'au self-service régional de la case scolaire, puisqu'ils sont 10, nous avons 10 régions. Mais alors maintenant, comment faire pour aller jusqu'aux écoles, jusqu'à l'établissement?
Merci
C'est
beaucoup.
ça le problème maintenant. Je vous remercie.
Merci beaucoup. Let's give him a round of applause and really just thank the panelists for, for sharing lessons as well as knowledge. If you can hear us, please clap once. If you're still with us, clap once. If you're still with us, clap twice. If you're still with us, move your head to the left and to the right. To the left, to the right. All right, thank you. Sometimes our voices can be soothing and we don't want you to fall asleep. We have come to a part where we get some questions from you here in the audience, but also those online. So if you have any questions, say aye. Aye? Okay, I see. There's some questions here. So let's start with the ones online. Maybe we'll take 2 online and then 3 in person. So I'll just pause them and then we can have time to respond. The first question is, I'll direct this one to UNESCO ICBA. And that is, what are some of the mental health challenges experienced by teachers and learners as well, especially in remote areas? And then there's also a question to Xavier on the course that you spoke about, the IEP course. There's a lot of interest online on how they can take that course, and if you could just clarify on that. And then there's a question for the minister. I guess is it possible for someone from the Maldives, for either the minister or an educational official to visit for benchmarking? I guess this is about visiting the Maldives for benchmarking. Are there any opportunities for learning and benchmarking? And then there's a question here about, can this integration we're talking about into education planning process, can it work in contexts where there are, for example, no sick beds in schools and no services, health services that learners can benefit from? So that's another question from online, and I'm not sure who can respond to that. So those are 3 questions. Is there any question in the room? Any question in the room? Okay. We need help with the mic. Thank you. So yes, that table.
Thank you very much, the panelists. My name is Teddy and I work with UNESCO in Uganda. I'm just interested in the I program, Eye Health. The question to Quentin, I'm just wondering if at ICBA, you've been able to do some bit of research to tell us the burden of eye health at global level, regional, or even at country level, so that this maybe would be a motivation for us to begin thinking of such a program for some of the countries. Thank you.
Thank you so much. My name is Arnold Kaira from Malawi. I'm the director responsible for inclusive education and school health. First of all, let me thank all panelists for presenting powerful and also elaborate, and also panelists online, the minister. What I have goes to Cameroon. You have lamented that there is reluctance by the private sector to provide data. So I wanted to know what mitigation or mechanism that you've put place to make sure that this one is put to end. Otherwise, they are compromising the program at all. So I just wanted to know, because the less you've put mitigation, but for this one, I haven't heard. Should it be like that or something else that's going to happen? Thank you so much.
All right, thank you very much. We're now going to get some responses. Maybe I'll start with you, Quentin. There's a question on eye health and then also mental health as well.
Thank you. I'll reply, but the real expert, he's right there, right? I mean, Don was one of the people in the world who started all of this work, and I think it was part of the Global Burden of Disease report or something like that. So a lot of what he said 10, 15 years ago remains completely valid today. But on your question, I think there were two questions from me. One, I think was about the prevalence of visual impairment or other types of disabilities, right? Actually, we did work on Uganda, and I can give you the estimates. We can assess prevalence using census data when we have the right questions, as well as household survey data. You don't go around and ask, do you have a disability? That doesn't work, right? But you ask what is called the Washington Group questions. Do you have difficulties performing different tasks? So in Uganda, and that's the case for many African countries, for visual impairment, the prevalence today is between 1% and 2%, right? In some Asian countries, the prevalence is 20%, right? What we know is that over the next 10, 20 years, and again, Don can correct me if I say anything wrong, but over the next 10, 20 years, in Africa and in countries where the prevalence of visual impairment is low, it's going to increase dramatically. Why? Because the kids are much more exposed to screens, at least some of the kids, right? And if you think about one type of disability that has a very high prevalence and rising prevalence, it is that one, visual impairment. The good news is that, as I mentioned, you can really find solutions that are affordable for ministries to implement. And we had discussion with Sarah, I guess you know her, in Uganda, about whether it could be done as part of a GP project or a project there, right? No country, as far as I know, in Africa has done a national school eye health program, not even South Africa. And so any one of you who would do it first, you would be the first one on the continent, right? So it's an important disability, it's a very rising prevalence, and it's solvable, right? And the reason why it has such a large impact is because if you give the kid a pair of eyeglasses, the kid learns better and is less likely to drop out of school, and there are lots of randomized controlled trials to demonstrate that. The other question was about MHPSS, if I remember, right? And what was the question again? It was the challenges for teachers, all right? So I don't want to exaggerate the issue of mental health among teachers, right? We have implemented surveys in a dozen countries and as well as other data. I'm not going to put a number because it depends on the country, right? You have a good minority of teachers who declare lots of anxiety, lots of distress, etc. There are different measures that you can use, right? It's by no means the majority, right? What you see though, is that the training in MHPSS that is given to teachers in most of the countries where we collect that data, very few teachers benefit from that training, right? Typically 20, 30%, depending on the country. There are exceptions. And if you train the teacher to be able to deal with mental health and psychosocial issues, that also helps the learner, right? And you also have actually sometimes even more distress or the effect of bullying and other things among learners than among teachers. One of the things I want to mention, the last one, is that we have tools, right? At ICBA, we have different training manuals for teachers. We have manuals for how you refer some of the issues. Luca is working on a manual on how to institutionalize MHPSS in the whole education system in Kenya. We have an e-learning course that is going to be available within a month. And perhaps most importantly, this morning, for those who are here in person, we had the African Union present, and we worked with the African Union to produce an Africa strategy on mental health and psychosocial support for teachers. Everywhere I go, everywhere my colleagues go, in a workshop, a conference, whatever deals with teachers, the issue of mental health comes very, very, very high. It's an issue that ministries are getting aware of, or teacher service commissions or teacher councils, and we are happy to help you. It's an important issue, and it can be solved as well.
Thank you very much, Quentin. Maybe I can come to you, Prof, if you want to weigh in around maybe IL.
Sure. Thank you very much. Yeah, it's a very interesting question. And it is an extraordinary fact that there is a real absence of the provision of glasses for school children in Africa. Just as Quentin says, there are some parts of the world, I mean, in China, the rates in school children can be as high as 30%. It's extreme. The problem I have of needing glasses from the age when I became an adolescent, there will be plenty of people in this room who had the same experience. It's called myopia, and you need glasses to refract, to change the refractive length, so you can focus. I mean, the only reason I got through education is because I had glasses, no question about it. So they're very important for some children. Now, the mysterious fact is that if you do a lot of close work, and as you said, it could be screens, but it could also be reading, or it could be sewing, or that kind, anything that's close work, that actually encourages myopia. It initiates myopia. So we find rural communities where children run around and are looking distant, have much lower levels of myopia than urban areas. That's true in Africa. So in African urban areas, like this one, the rates of myopia in children are just as high as they are in some other parts of the world. Not as high as in Asia, though, it seems. But not so much in the rural areas, because the children spend less time in school. So it's a complicated equation that's involved. But the real question is what you do about it. Because the problem is, yes, teachers can screen to show that some children have myopia, are unable to see things, but then what happens to the child? The model for optometry in Africa, just as it is in Europe and much of the world, is that it's a very high return investment. Somebody trains as an optometrist and then charges hundreds of dollars for a pair of glasses. You can also produce the same glasses, just as you said, for $1, $2, $3, $4. But where are the optometrists who will prescribe those glasses? So the system is a complicated one, but I absolutely follow the suggestion that if a country wanted to really focus on that, you could be a trailblazer, because there's no question that it's needed. And just one point to add. Let's not forget the teachers. Every time I've been involved in going to schools, testing glasses, testing eyesight, I've handed out glasses to more teachers than children, because the teachers now, they don't get myopia, they get what I've also got, presbyopia, the inability to read easily, when we start moving the page away from ourselves to read it. That's a natural thing over 40. And teachers don't get prescribed glasses either. So that would be for me also one of the big things that we should include in the thinking.
Thank you very much, Professor. And maybe we go to you, Xavier, first. The question around the course, but also there's another question tied to that is, does the implementation of this program of work include training for educators who are outside the system, maybe pre-service, and health workers as well? That's the question.
Thank you, Remy. For the course, I would really encourage ministries of education interested to get in touch with UNESCO offices in their countries to manifest an interest. I have to admit that the number of places in the course is limited, and that we will have to have different waves of implementation, of delivery of the course over the years to meet the demand. One of the criteria that we will very likely use to select participants and to fund their participation will be the imminence of planning processes or the existence of current planning processes so that we can actually contribute to something that is going to happen or something that is already happening. So, but the course will initiate in the third quarter of 2026 if everything goes well. So we will certainly refine the selection criteria from now to then. As regards the extension of the program, well, I think this is exactly the point. It is for ministries of education, together with other ministries, to decide based on the tools and resources that we make available to them, what are the needs, where are the programmatic gaps, and where are their own priorities. It is not for us, UNESCO or any other partner, to decide what to do and where, but it is for countries to have the means and the capacity to conduct a process that permits them to meet health and well-being demands, necessities in their own countries. And in partnership with other sectors.
Thank you very much, Xavier. Would then want to hear from Cameroon's perspective, Mr. Awono. The question was on, you mentioned there's a challenge from private sector not submitting data and sending, empty data sheets. What are the mitigation measures that you've put in place? How do you prevent that or address it?
Je vous remercie. Pour répondre à ce problème, lorsque nous avons ces cas-là, nous le portons déjà à l'attention de Monsieur le ministre, qui qui pour le moment passe par la sensibilisation, sensibilise les présidents, puisque les privés sont regroupés, hein, ils ont plusieurs regroupements, donc on sensibilise les présidents de ces regroupements-là pour amener les responsables d'établissement à collaborer à la collecte des données. Et maintenant, à notre niveau, ce que nous faisons aussi, c'est que lorsque nous avons terminé, au lancement de la collecte d'une année, on sort le classement de l'année précédente. Et maintenant, on classe les arrondissements. Et en ce moment-là, les inspecteurs qui sont les responsables au niveau des arrondissements, chacun se trouve indexé et à son niveau, à leur niveau, ils adoptent quelques solutions précaires, mais qui passent. Ça fait donc que depuis un certain temps, le phénomène est en train d'être géré. Par exemple, lorsque ça tombe au moment de la publication des résultats, on vous dit, si vous ne remplissez pas le questionnaire de la carte scolaire, vous n'avez pas les résultats de vos élèves aux examens, par exemple. Et donc, les chefs d'établissement s'empressent à ce moment-là de collaborer et de remplir le questionnaire. Et voilà comment ça se passe. Et tout en gardant en vue qu'il y a la menace de fermeture de la hiérarchie. Je vous remercie.
Thank you. Thank you very much. Thank you for sharing how you've proceeded to deal with that challenge. Minister, I don't know if you're still connected. What do you see as some of the opportunities for benchmarking and sort of learning as we embark on this work? Here in the room, we have about 24 countries. And, if you could just reflect on some of that.
Yeah, thank you. I think that's something really important to have a collaborative effort. And it is also important to learn from other countries. So from the Maldives side, we are very willing to engage in any sort of collaboration to learn how we can integrate these indicators in the EMIS, because since we are also in the process of developing the new EMIS, we have our past learning, but in the meantime, it would be really good if we can come together and share our learning, and we can that is how we can develop and how we can move from the current status to the next status. And we are definitely very welcome, and even we will be happy to engage in any sort of learning as well. And we are also willing to share our learnings with the international community, and we are also eager to receive the learnings from the best practices that have been experienced in other different contexts. And even the Maldives context is very different. We have more than 1,000 islands, but people live in around 185 islands, and the 217 schools across the country are very much geographically displaced. So we also have unique challenges in terms of the human resource and all these areas. So when we try to collect data, still there are difficulties, but we are trying to use the recent technologies in our new EMIS because it is going to be one of the important aspects when we try to come up with a more comprehensive data system. And before I conclude, let me also highlight something very crucial, because the Ministry of Education alone can't do this. And it should be very holistic, and it should be a very collaborative, and also we should have national level policies and priorities, which is cross-cutting with different sectors. One of the example is the Maldives is one of the country that has already banned on the import of e-cigarettes and also the vaping devices. And also let me also highlight that with the vision and also national level of policy initiative of our president, the Maldives has banned young people born on after 1st January 2007 from smoking tobacco, which becoming the only country in the world to reinforce nationwide generational tobacco prohibition. This is also to ensure the health and well-being of our young generation. And there are certain other very key policy level decisions taken at the government level. For example, from January 2026 onwards, even all the people of the country will definitely get insurance to fully cover the mental health treatment. And also the government has established a mechanism to provide the eyeglasses for almost, the entire population, which is indirectly facilitating and contributing to our students in the education system. So I just thought to highlight this. Thank you very much.
Thank you. Thank you very much, Minister, for your reflections. We are now just 3 minutes before this part of the conversation ends, and I would like maybe to just give a chance to the panelists in under 30 seconds. Sure, because it's a young person. Yes, I will. Yeah, where's the other mic?
Thank you so much. Yes, thank you so much. For those online, my name is Angel Babidia. I'm the president of AFRIAN East and Southern Africa, and it's a regional youth network spanning 16 countries in East and Southern Africa. So I really love the conversation that's been going on. I just wanted to also remind us that we've been talking a lot about multi-sectoral collaboration, and most of the people that we've been looking at are UN agencies and also the different ministries. But if we really want the education sector plans to reflect the lived realities of young people, then we have to make sure that we also engage them, especially when we go back home. We're looking at these different documents, and we're going to travel back home and, you know, sit down and adapt them and contextualize them. But it's very important for us to also make sure that they are really rooted in the lived realities of young people. You can't engage them individually. You can't engage them through the different youth networks through which they converge, like AFRIAN, so that at the end of the day, you are really addressing the lived realities. So that's what I wanted to remind us. Let's not forget the young people, even when we go back home. Thank you.
Thank you very much. That's an important reminder indeed, and continuously engage young people meaningfully and co-create solutions for this. And so I just want to hear, quick reflections, final thoughts, under 20 seconds from each panelist, and we'll just go with the row from Clinton going this way.
30 seconds. On the one hand, as ministries, you want to be comprehensive. On the other hand, I would urge you to identify a few high-impact, affordable interventions that you can actually put in place at the national level. School Health is one, there are many others. So we are happy to work with you. We are happy to provide advice. We are happy to provide training, but you need to start somewhere. And if you can identify those few interventions, high impact and affordable, that would be a great start.
Thank you. Linda?
Thank you very much. For Zambia, as I said, that our president is a champion for foundation learning in Africa. We have high-level support in this regard, and early childhood for children to come to school is one of the priorities. But yes, we need to identify high-impact indicators. And like I said, we are in the process of enhancing our EMIS. And this is one of the priorities that we're going to take back home as we prioritize. And then I also want to say, as Zambia, we commit to begin the eye screening program coming from the Ministry of Education and Director of Planning. We will take back home this program. And we already have our partners that are started this. We have the health learners partners that have started this on a smaller, note, and we are going to take it up as Ministry of Education. And I also wanted to just say that we're moving forward, we'll engage our UNESCO country office to kickstart this program. I thank you.
Thank you. Prof.
Well, my quick remark is the Ministry of Education is not meant to replace the Ministry of Health. So the targets are to think about the things that will help children now, yes, but which will stay with them throughout their lives so that they understand what their relationship with food, they develop healthy habits, and so on. That's really the target we're talking about. It's not about fixing medical problems immediately. I think it's important to be distinct in your thinking about what needs the investment.
Sure. Pass it over to just 20 seconds reflection.
Oui, je vous remercie. Nous avons compris que aujourd'hui, les questions de santé, les questions d'environnement, de santé mentale, de santé et bien-être ne sont plus des questions périphériques, hein. Ce sont des questions centrales. Donc, nous allons continuer à développer des indicateurs que nous allons intégrer dans notre système d'information pour la gestion de l'éducation.
Xavier?
I believe this is the first time in history that so many partners join forces to address the health and well-being of learners and teachers in education systems, to address sexual and reproductive health, mental health, violence issues, eyesight, nutrition, and any other health issue. I believe this is now our collective responsibility with member states to make it work.
Thank you. Minister, just under 20 seconds, your final reflections and thoughts?
Thank you. To implement these high impact interventions, we need three things. One is the capacity building. Another one is the stakeholder collaboration. And finally, the investment are really crucial for the implementation of these interventions. Thank you.
Thank you very much. Thank you very much, even to the audience, both online and in person. And one colleague that has been listening in is Sally Joanne Gear from who is the Gender Equality and Inclusion Practice Lead, Global Partnership for Education. And she's going to give us some reflections, closing reflections on behalf of the Interagency Group for School Health and Nutrition. Sally, if you can hear us, please, can you give us your reflections?
Yeah, I can hear you well, and goodness me, what a fantastic, rich discussion this has been. And I think I've got an absolute impossible task. So I'm certainly not going to be summarizing what's been said, but it's first of all, just a huge shout out to UNESCO and the African Union for hosting this amazing meeting. And I think we've just heard this is pretty groundbreaking. So having a number of agencies, numbers of countries participating. So yes, I'm very humbled to be asked just to give a couple of reflections at the end. But actually, I'm not here representing myself or actually GPE either, but the Interagency Group of which we're a part. So a huge shout out to them and for the work that they've done and being involved behind the scenes. This is definitely something that is a load of thought, a load of collaboration has gone into and time, and now it's available. It's so good to hear that and ready to go with all the different elements of that we've heard about before. We've heard really, really clear messages on the rationale and the evidence we have now about the importance of school health and nutrition being well integrated into planning and into systems to enable all the achievements we want from education. Obviously, it's the right thing to do, but we've also heard the really strong evidence about the impact within education on learning and access and retention in schools. And I think we really, it's really important to take, probably would say this, and I'll come on to examples, this important of integrating gender and inclusion in this approach, because obviously girls and boys have different needs on this agenda. And we've also heard very much about learners with disabilities and how this agenda can really help ensure that no child is left behind. So the speakers really reiterated those. The importance also, I heard very, very strongly about multi-sectoral partnerships, and this is very hard to do. We know that, and we talk about it a lot. It's hard to do at a national level. It's hard to do at a local education level as well. But I'm hearing this a lot now. We're talking that, working in silos, particularly in the current climate, isn't going to achieve the outcome. Children don't work in silos. So I think what we need to do is be able to do that wraparound and try and make sure that we're taking that approach. And so working across ministers and also working with ministries of finance when we're presenting this agenda. I've seen some smiles in the room on that. I mean, we need to present this as a holistic approach. And also we heard a really strong value for money argument earlier on. And then the importance of national systems. So heard very much about data collection, reforming EMIS, thinking about curricula, thinking about teacher training and what's in that curriculum, but equally recognizing that and really powerful intervention about the mental health of teachers, which I'm going to take away, that, we can't put this all on teachers. We have to recognize this has to be a collaborative approach as well, and also make sure that this approach addresses, and that is very much what the systems approach is about, it's looking at the students, but it's also looking at all the other actors and agencies who support those students and making sure those systems are in place to support them as well. And this is very much what, as GPE, we're trying to do going forward. We have, as many of us, we've got many partners in the room. Taking a systems approach to this is the right way forward. We've got the evidence of that, and that's definitely where our heart is. And moving forward to our new strategy, ensuring that we're really building up, addressing the sustainable finance piece of this. All of this involves finance, as many of you know, making sure that's sustainable, making sure it's country-led, and we're addressing these systemic barriers to learning, gender and inclusion within our education systems. So I think my colleague Belay was with you at an earlier session in person, so I'm sure he shared some examples, but just to share one that we partnered with Somalia, particularly looking at the gender dimension of this piece. So the education sector analysis, which happened in 2022, really highlighting gender disparities, recognizing that violence, gender-based violence, which is very much part of this agenda because that's about health and well-being in schools, but also about menstrual health management. And through the Girls Education Accelerator, we're able to partner to take that cross-sectoral approach. So working with health services in terms of the menstrual health management dimension, and also looking at social sector and response systems for the gender-based violence piece. So using that sort of cross-sectoral approach, and particularly as we know, girls affected by FGM in certain countries, this can't be dealt with just by the education sector alone. We need to work across ministries as well, and sectors also as development partners. Just also to share, we've heard about the importance of nutrition, and obviously an aspect of that is school feeding, and that's been a huge priority for a number of GP priority partner countries. And just to flag that we have this technical assistance initiative, which is really looking at trying to ensure again that we're building capacity, and also that whatever we do on school feeding is financially sustainable and cost effective, because obviously that's important for the longer term. And Zambia is one of those countries where the facility is piloting at the moment. So just to conclude, this wonderful handbook we now all have is a hugely helpful resource. As I've said earlier, it's evidence-based, a lot of heart and soul has gone into it, a lot of good evidence and research, and it's a tool that will help with monitoring and evaluation of school health and wellbeing programs. And we've already heard from a wonderful colleague from Maldives who've really taken a leadership role in pioneering this and piloting that. And we can all learn from that process. So just really on behalf of the interagency group, I just want to say I'd really encourage everyone to use this, to look at it, to where possible to be able to work on the training, because this is a great resource for us all, and obviously we'll be encouraging that with partners within the GPE. So, and then a last thank you, because I know there are a number of you in the room who are maybe ready for lunch. I'm not quite sure what stage we are of the meeting, and we've heard about the importance of nutrition earlier. I think that thank you for your time. Thank you so much for this really exciting new agenda, and I really also want certainly our partner countries to hear that a number of partners stand ready, including the interagency, to support you in this important journey. So thanks ever so much, everybody. Yes, I hope you have a good rest of the day. Back to you, Chair.
Thank you. Thank you very much, Sally. And you've wrapped it up very well for us. And let's just, thank the panelists first. If you could give them a round of applause. But also, even more importantly, to thank yourselves, please. The past 3 days have been wonderful. We've achieved great things together. We started off with a technical meeting for 2 days, and then today, the global launch of this program of work on planning for healthy and thriving learners. And this is not the end. It really, like we heard from Sally, the partners who are also behind this work stand ready to support you and to work with you. We can facilitate also cross-country learnings. If you picked up that you would like to hear more or learn more from a particular country from this room, or even not from this room, we're able to facilitate those conversations. So on that note, I just want to thank you very much, and to thank Camelia also for the webinar, and everyone behind the scenes for the great job. Well done. Thank you so much. We've come to the end. Merci, merci beaucoup à tous et à toutes.
Before everyone leaves, if you could kindly take 2 minutes to fill out the satisfaction survey and give us your feedback about this session, that would be great. Can you put the QR code up? Yes, this one. Thank you. Thank you so much, everyone. I hope you had a great experience. Thank you.